Okay, class, for this week, our topic is about handling and processing of blood specimens. So next week, our topic is related, no? Okay, and that will be, of course, handling and processing of non-blood specimens, yung urine, CSF. So for this week, blood specimens muna tayo. Okay, so let's start. So the quality of laboratory results, okay, depends on proper handling of the specimen in the pre-analytical phase. Okay, which includes, of course, all the steps taken before the actual testing of the sample. So according to studies, no, about 46 to 68% of all laboratory errors occur prior to analysis. Okay, kaya we are going to review, no, yung mga pre-analytical errors natin. Okay, specimen handling is a critical part of this phase. So proper handling from the time a specimen is collected until the test is performed helps ensure that results obtained on the specimen accurately reflect the status of the patient. So very important yon, no? The result of a test is compromised when the proper collection procedures, no, the transport, the processing, and the storage, no, if these protocols, okay, were not followed, okay, hindi tama yung ating magiging result. So, okay, ang i-discuss natin ngayon is anong gagawin natin dun sa specimen, no, after collection. Okay, and then yung time frame na yan, no, so after collection hanggang doon sa tawag dito, uh, analysis of the specimen. Okay, so tawag natin dyan is handling and processing of the specimen. So that includes, of course, yung mixing, yung transport, no, and then of course yung centrifugation, no, separation of the serum and the plasma, okay, or plasma from the cells. So yun, kasama yan dito sa ating discussion for today. Okay, so again, no, bago tayo pumunta doon, punta muna tayo dito sa mga naaral natin. So yun, ano ba yung mga pre-analytical errors natin na diniscuss before? No, hanggang sa time of collection. Okay, so aralin natin, no, re-review natin kasi that's really very important. You see, 46 to 68%, that's very high. No? Okay, so start po na tayo sa improper patient identification. Okay, so sabi dito, this is the most serious, potentially most dangerous pre-analytical error. That's why very important is you're going to identify properly your patient. So you're going to ask, may I know your full name po? No? Okay, and then ask another identifier, can be the address, can be telephone number, or can be the date of birth. Okay, so very safe na yung date of birth. Tama na? Okay, the name and the date of birth. Okay, so dalawang ayun, mag-identify sa kanya na siya talaga yon. So very important yan. Okay? And then of course, okay, review natin yung ating mga possible sources of pre-analytical error before collection. So pasok dyan yung mga physiologic variables. Okay, age of the patient, no, yung altitude. Okay, in passing lang natin to, no? Kasi naaral na natin yan, no? Yung dehydrated patient, okay, that causes hemoconcentration. Tama, no? Sa exercise, gender of the patient, iba yung normal value pag bata, iba yung normal value pag matanda. Tama na? Okay. And then of course yung fasting, inadequate fasting. So very important ito. No? Kailangan pag yan ay glucose can be 8 to 10 hours. Pag triglycerides, 10 to 12 hours. So kung may glucose, may triglycerides sa test niya. So dapat ang fasting niya is around 10 hours. Okay? And then of course, yan, incomplete requisition, tsaka yung wrong test ordered, okay, related yan, no? Okay, minsan kasi, di ba, yung pag-tick, no, yung pagpili doon sa mga test, halimbawa sa computer, no, o kaya yung pag-check, no, di ba, minsan tinecheckan lang yan. So, nagkamali lang ng pag-check. Okay, so that can be, of course, source of pre-analytical error. No? So, medications, the patient's stress, tama, pregnancy, smoking. Okay, so naulit yung exercise natin dito. Treatment tsaka medication, okay, pareho lang yan. So these are possible sources of pre-analytical error before collection. Okay, now punta naman tayo sa at the time of collection, during collection. So ano yung mga possible errors natin dyan? Now, so yan, of course, misidentification of the patient. Okay, antiseptic, not dry. Now, so of course, lagi natin sinasabi, you're going to wait for the specimen to, okay, a specimen, the skin, no, or the antiseptic to dry before you're going to insert your needle, right? Okay, so not drying, okay, not drying the alcohol may cause hemolysis because of alcohol contamination, no, and of course, yung patient, no, feels burning sensation, mapdi, when the needle is inserted at hindi pa dry yung alcohol mo. So you have to wait for the alcohol to dry, your antiseptic to dry before you insert your needle. Now, very important also for the antiseptic, if that's for blood alcohol testing, okay, do not use alcohol as antiseptic. That will interfere with your analysis. Nag-alcohol testing ka nga, tama, tapos alcohol yung ginamit mong antiseptic. Kaya anong gagamitin mong antiseptic? O marami namang antiseptics dyan na hindi alcohol, right? Okay, you can use your iodine, you can use your chlorhexidine gluconate, right? Okay, and then of course the expired tube. No, so that is why you have to check first, no, the expiration date. Okay, sa tube nyo before you're going to use that for blood extraction. Okay. Wrong collection time naman. Okay. So remember, merong mga you have to collect, tama, na mga 2 hours postprandial. So you have to collect that 2 hours after meal. So tawag natin dyan 2-hour postprandial. Okay. So kailangan correct timing. Okay? And then of course, yung dapat i-collect mo pag morning, no? Like the cortisol, yung mga affected by the diurnal variations, yung mga ganyan. Okay? Very important yung timing. Okay. And then next, of course, okay, yung incorrect needle position. Okay, so remember that you're going to maintain the needle position while the tubes or the syringe actually ay nalalagyan ng blood, right? Okay, try not to pull up or press down or move the needle back and forth or sideways in the vein. So these actions can actually be painful to the patient and enlarge the hole or the opening in the vein, okay, resulting now in leakage of blood and of course, the hematoma formation. Kaya kailangan naka-steady lang yung iyong needle. Okay, so another problem also, no, yung pag yung needle mo is being inserted too deeply. Okay, so causing now to penetrate all the way through the vein. Tawag natin dyan through and through. No, so this can occur if the tube holder is less steady. No? Okay, tapos yung tube mo is being pushed. No? Right? Tama. No? So yung tube mo, habang pinupush mo yan, napupush mo pati yung needle mo. Okay? So nagto-through and through ka. Or if the needle position, tama, okay, yung angle mo pala ay too steep, no? Masyadong mataas. Masyadong yun, mataas yung angle mo. So possible din yan na mag-insert ka too deeply. Okay? Ma-penetrate ka all the way through the vein. And that can, of course, result to hematoma. Okay? So, kailangan i-correct mo yan, okay, by slightly withdrawing the needle to re-establish now the blood flow. Okay? So, and then, of course, yung mislabeled tube. So, pag sinabi mong mislabeled tube, it's just like, ano na yan, no? Kamag-anak yan ng misidentification of the patient. No? Lalo na pag iba yung nalagay mong label doon sa tube mo. Okay, and then of course another cause of error will be the non-sterile site preparation. So remember that you're going to apply antiseptic, no? Wait for that to dry. Tama, no? So very important, of course, para walang contamination, okay, at hindi magkaroon ng infection yung ating patients. Okay, so next will be, of course, the incorrect, okay, collection tube. Ayan. So very important ito, tama? Nasabi mo, ma'am, tapos na po kami dyan. Yes, no? Uulitin natin kasi this is very important. Okay? Napaka-importante nito for you, no? Okay. So you have here the color. So marami pang colors yan mamaya. No? Okay, ito lang yung napaka-importante gusto nating emphasize. Okay, so pag yan ay blue, of course that contains sodium citrate, and that's best for coagulation studies like your prothrombin time and your activated partial thromboplastin time. Okay, and if that's lavender, okay, that contains EDTA. Okay, and then of course that's best for hematology. Okay, and then pag sinabi mong hematology, okay, complete blood count, and if platelet count is requested separately, no, kailangan mong lavender, no, or EDTA kasi hindi nag-aggregate yung platelets dyan. Okay. and that actually preserves the cells well. Okay, kaya yan yung best. And then of course, for ano naman, pag yan naman ay green, that contains heparin. And heparin is best for blood gas analysis and for electrolytes determination. So pang chemistry din yan. Okay. Now, pag gold or orange, meron niyang clot activator, and that's for chemistry. Tama na? Okay. Kasi serum. Pag sa serum, pagka-chemistry, ang best or commonly used specimen dyan is serum. Okay. Kailangan natin ng clot activator. Okay. Pag red plastic, okay, meron din yung clot activator. Pag gray naman, that contains sodium fluoride, and that's best for glucose determination because this sodium fluoride prevents glycolysis. Okay. So, pero kung halimbawa marami kang tests tapos kumuha ka na doon sa gold and orange, usually yan na rin yung ginagamit nila for glucose determination. Okay? Ginagamit lang itong sodium and fluoride pag alam nila na there's the delay na yung kumbaga hindi agad-agad ma-analyze yung specimen. Okay? So ito, ayan, ay very important yan. Huwag niyong kakalimutan ito. So you have the light blue. Ito yung dati naming stopper. Okay, hindi na ginagamit yan ngayon. Okay, mas safe kasi ito. May HemoGuard cap. Okay, so para pagbukas mo ng takip, ng stopper or cover, okay, hindi mo nahahawakan yung blood. Okay, unlike dito kasi pagbukas mo ng stopper or ng ito, okay, so yung blood nandito. So kaya tawag dyan HemoGuard. Okay, kasi when you open this, tama na, so hindi mo nakikita yung blood kasi may cover. Okay, so ito yung additive present, and then ito naman yung number of inversions. Okay, so mix how many times yung pag-invert mo during mixing. Okay. And then, ito yung gamit niya. So, alam na natin, that's for coagulation studies, right? Okay. So, and then pag lavender naman, okay, sabi natin, dalawa yan. You have your liquid, okay, tripotassium EDTA, and then you have the spray-coated, dipotassium EDTA. So, 8 times ang conversion yan. Okay, or inversion. Okay. So, yan, so can be of course for CBC yan. Okay, and then yung white naman, okay, that also contains ADTA, and then that's for molecular diagnostic testing. Okay, and then pag pink, okay, that's best for blood banking. Okay, so ginagamit din yan sa hematology, okay, pero ginagamit din yan sa blood bank. Pag sinabi mong blood bank is now known as immunohematology. Okay, so yan, donor screening. Okay, and then yung gold, okay, ito yung dating itsura niya. So ngayon ganyan na siya. Okay, meron niyang clot activator, so 5 times yung inversion. Okay, for chemistry yan. Okay, pag light green naman, okay, so 8 times yung kanyang inversion. Okay, so pang chemistry rin yan. Okay, so usually yun nga, pang yan. And then of course, you have here yung ating red. Okay, pag yan ay glass, okay, do not invert. Okay, wag mo siyang i-invert. Hindi kailangan i-invert yan. And then of course, pag yan ay plastic, okay, may clot activator yan, you have to invert 5 times. Okay? And then pag orange yan, okay, may thrombin yan. So 5 to 6 times. Okay? So, ayan. So, 5 to 6 times tayo usually pag yan ay thrombin. So, yung thrombin natin, very important ito. Kasi, ano yan, 5 minutes lang nagka-clot na yung ano natin, yung specimen natin. So very very fast, Okay. So kaya nga for stat serum determinations in chemistry. Kasi yan, okay, blood clotting in 5 minutes. Okay? And then for royal blue, okay, that's for trace elements. Okay, ayan. So yun yung naaral nyo naman na yun before, right? Okay, so ayan. So punta naman tayo ngayon, okay, still on yan, during the time of collection, incorrect order of draw. So review naman natin ngayon yung order of draw. Okay, so of course, alam na natin ito, sterile muna, yung yellow, tama? And then you have the coagulation tubes, and then you have the serum tubes, tama na? Okay. And then you have the heparin tube, okay, and then the EDTA, and then the fluoride. So usually una muna natin yung ating plain tube bago yung may clot activator, na? Okay. So ganito yan, na? So nandito yung rationale, okay. So you have here, of course, kailangan muna natin yung blood culture, right? Yung sterile, okay, number of inversion. Okay, so yung number of inversion dito, may konting ano lang sila, parang difference, no? Konti lang naman. Kagaya nito, halimbawa ito 8. Okay, dito naman 8 to 10, no? So or 8 times din. Okay, doon pala sa isa yung 8 to 10. Okay, so but anyway, okay, so you have here, so 8 to 10 times. Okay, so una muna ito, okay, para maiwasan natin yung microbial contamination, no? So ito muna, no, sterile muna, and then after that, no, okay, yung ating coagulation tube. So sabi dito, this is the first additive tube in order because all other the additives daw, okay, can affect the coagulation testing. No, so yung mga ibang ano natin dyan, mga anticoagulants natin or additives can affect the coagulation tests. Kaya unahin muna natin siya. Na? Okay. So lalo na yung EDTA tsaka heparin, nakaka-increase yan ng coagulation testing natin. Kagaya ng prothrombin time and then the activated partial thromboplastin time. So kailangan unahin natin siya. Na? Okay. And then next, yung ating plain glass tube. No? Okay. So, ayan. And then after that, yung may mga clot activator. No? Okay. And then after that, yung mayroong separator. Okay. And then after that, you have the heparin. Okay. And then the EDTA. Okay, so yung heparin natin causes the least interference dito sa ating mga, dito sa tatlo. Dito, ayan. No? Okay, so other than the coagulation testing, kaya siya muna. Okay, bago yung EDTA. So yung EDTA is responsible daw for more carry-over problems than any additive. Kaya dito siya sa second to the last. Okay, so remember yung principle natin dito, bakit ba may order of draw? Kasi di ba yung carry over ng additives, tama? Yung pwedeng maiwan yung additive doon sa kay rubber, tama, no? So that will now affect the result doon sa mga succeeding tubes. Kaya nga ito, no? Sabi dito, responsible for more carry-over problems than any additive. Kaya dito ka. Okay, dulo ka na. So it elevates, okay, sodium and potassium levels. Kaya kailangan after siya ng heparin. Kasi usually, di ba, ito ay pang ano natin to pang electrolytes determination. Tama? So pag inuna mo itong EDTA bago mag-heparin, naku, okay, tataas yung iyong sodium and potassium. Okay? So kaya kailangan dito siya. Okay. Now, next bakit dulo yung fluoride natin? So remember, dito sa ating gray tube, meron niyang fluoride, meron niyang oxalate. Diba? Kasi yung kailangan niya ng anticoagulant, right? Okay. So yung fluoride kasi is a weak anticoagulant. Okay. So kailangan niya ng kasama. So the oxalate is used, tama, okay, after yung hematology, okay, kasi yung oxalate dito interferes in the enzyme reaction, okay, damage the cell membranes and causes abnormal RBC morphology. So remember dito, ang tinitingnan natin yung RBC morphology, right? Okay, kaya dulo siya. Okay, kasi yung oxalate natin. Okay. So yan, no? Yung order of draw natin, very important ito. And then of course, you're going to study the rationale. Okay, para hindi ka, bakit nga ba ganun? No, bakit ganyan? Okay. So again, ito yung ating order of draw. Okay. Now, still, okay, at the time of collection, okay, wala pa tayo dun sa main topic natin, which is handling and okay, processing. No? Okay, yung underfilled tube. Okay, so kulang. No? So incorrect volume of blood in the tube. So ang very critical, most critical dito will be the citrate tubes for the coagulation studies. Okay, so kailangan ang ratio niyan is 9:1. Okay, so 9 part of blood, okay, and 1 part of your anticoagulant. So, yan. So, pag kayo 1 ml yung anticoagulant mo, kailangan 9 ml yung blood mo. No? So, kung 0.5 ml ito, 4.5 yung blood mo. Ganun yan ang ratio. Okay? So, pag less yung blood, di ba kulang yung dugo? Okay? Merong dilutional effect. No? So, nadadilute yung blood mo ng iyong additive kasi mas konti yung blood mo. So, dapat 9:1 yung ratio. Okay, pag too much blood naman, no? So halimbawa, mas dumami yung blood kaysa doon sa anticoagulant na ratio mo, no? So dapat 9 lang and dumami, right? Okay, so that can cause of course clotting. Baka mag-clot. So kailangan tama yung ratio. So ayan, no? So for ayan, partially filled tube kailangan mag-collect. Okay, especially for this one. Okay, for the citrate kasi very crucial yan. Okay, so in other laboratories they allow mga 10% no kung yung kulang. Okay, so ina-allow na nila. Okay, iba very strict. Okay, so do not combine two partially filled tube. Halimbawa kumuha ka tapos hindi mo napuno, no, na out of vein ka. Okay, kuha ka ulit tapos hindi mo naman napuno, no, na out of vein ka. Then sabi mo, pagsamahin ko na lang ito. Okay, so hindi pwede yun kasi yung una mo na-dilute na yun, yung iyong blood. Okay, kasi mas konti yung blood na nakuha mo. And then, pangalawa mo, dilute na naman. Okay, so you're going to have erroneous result. Okay, so and then do not combine serum and plasma. Okay. So, yan. So, yung underfilled tube, halimbawa ang ano lang to, ina-accept lang nila ito. Kung halimbawa yan ay halimbawa plain tube, right? O kaya discard tube. Tama? No? Okay. So, walang additive. Right? Okay. So, tapos, halimbawa, 3 ml yung nakuha mo. Dapat 5 ml. Okay? So, yung iba, ina-allow na yan as long as may makuha silang serum. No? So, anyway, wala namang problem with the ratio. No? Yung anticoagulant and the additive ratio. Kasi wala namang laman. Glass naman yan. No? Okay. Now, ito, no? So, at the time of collection pa rin, the patient's position. Ayan, aral natin yan, no? Okay. So, yung Clinical and Laboratory Standards Institute recommends that blood specimen should be collected now with the patient comfortably seated, nakaupo, okay, in an appropriate chair or lying down, nakahiga. So, yan yung dalawang recommended position ng patient during blood extraction. Okay, so yung posture may of course influence the concentration of the several blood constituents, no, due to the decreased plasma volume occurring on changing the position from lying to standing. Okay, so magkakaroon ng hemoconcentration kasi yung standing posture may be a cause of blood concentration, yung effect daw ng gravitational force, no? And then the hydrostatic pressure. So magkukause yan ng ultrafiltration of plasma, no? At saka yung small molecules papunta doon sa interstitial space. Okay? Kaya magkakaroon ng hemoconcentration. Okay, now there's also what we call as the hemodilution, no? Okay. So yung pag patient daw ay remain supine for a long time, yung mga bedridden, no, yung mga talagang hindi na tumatayo, no. Okay, this may be associated with hemodilution. So yung hemodilution naman is the opposite of the hemoconcentration. Okay, it means decreased concentration of cells and solids in the blood resulting from gain of fluid. So kung yung hemoconcentration, lumabas yung fluid, pumunta sa tissue, ito naman, no, from the tissue, yung water pumasok doon sa blood vessel. Kaya nagkaroon ng hemodilution. Okay? So, next, of course, so another will be yung arm down position pagka nag-venipuncture tayo or vacutainer method, no? So kailangan yung arm naka-down position. Okay. So, ayan, ganito ha. Okay, para yung ano natin, blood hindi magfo-flow back dito sa needle. Kasi pagka ganito yan, yung blood natin nagfo-flow back doon sa needle natin. Tama? No? Okay. So kaya kailangan ganyan. Okay, para yung blood natin nandito. Right? Okay. So Another, no, yung time of collection pa rin. Remember, nagre-review pa lang tayo, no? So prolonged tourniquet application or tourniquet application. So ano ba yung ideal? Okay, not more than 1 minute. Okay? Kasi magkakaroon ka rin ng hemoconcentration if there's prolonged application of tourniquet. Okay, and that should be 3 to 4 inches above the site. Okay, and then now, punta na tayo sa transport. Ayan, tapos na tayo doon sa collection. Okay, so tapos na tayo. So dito ngayon, okay, dito na papasok yung ating handling and processing. So that's actually after the collection, no? Okay. So pero mamaya pa, no? Punta muna tayo dito sa transport. Okay? So agitation, no? Okay, pagka nagalaw mo yung iyong specimen, okay, that can cause hemolysis. Kaya nga meron tayong agitation-induced hemolysis. Okay, can be also during transport, pwede ding possible reason of pre-analytical error will be delay in transporting. Gaano ba ano ba yung time, no? Okay, time limit. Okay, para madala mo siya sa laboratory, mamaya aaralin natin 'yan. And then yung exposure to light, no? Okay, ano ba yung mga specimens, no? Yung mga tests that will be tests, no, na kailangan yung specimen mo should be protected from direct light. Okay, so aaralin din natin yan. At saka ano ba yung mga temperature requirements? Okay, so aaralin din natin yan. And then you have the transport method. Pag sinabing hand, hahawakan, no? Okay, syempre kaya nga hand. Meron tayong isang method, no, ng pag-transport which we call as pneumatic tube. We are going to study that later, no? Okay. Now, during processing naman, okay, so syempre, okay, delay na naman yan. Okay, delay in the fluid separation kasi yung processing, sa-separate mo na yung serum, okay, at saka yung plasma from the cells. Okay, pag may delay, ano kayang mangyayari? No? Okay, and then pag nag-evaporate, hindi mo tinakpan, no? Ano kayang mangyayari? So, yan yung aaralin natin. No? Okay, so ayan, failure to centrifuge specimen according to test requirements. No? Okay, failure to separate fluid from cells. Okay, and then incomplete centrifugation. Okay, mamaya aaralin natin itong mga yan. No? Mislabeled aliquot. Okay, and then multiple centrifugations. Okay, and reaming of clots. Yung reaming of clots, naku, guilty ako dito nung ako'y intern, no? Kasi hindi naman sinabi sa amin before. Yun naman talaga yung ginagawa namin. Kasi before, wala kaming clot activator, na. Okay, so walang clot activator. So ang ginagawa, no, inaalaw namin mag-clot yung specimen. Tapos niriring yung gilid niya, na, okay, with applicator stick before centrifugation. Yan yung reaming of clots. Okay, that can cause daw kasi hemolysis. So ngayon din na yan ginagawa. Lalo ngayon meron na tayong clot activators. Okay, now, during storage naman, ayan, no? So can be error also yung expose mo na naman sa light, right? Okay, so yung mga photosensitive na mga, okay, analytes. So mamaya aaralin natin ano ba yung mga yon, no? Okay, and then yung temperature change outside the defined limits. Kasi meron dapat i-transport mo with the ice, no? Okay, or sa cold temperature. Yung iba naman dapat naka 37 degrees. So yun ang aaralin natin, no? Okay, very important yan. Okay, now, site na tayo, no? So when you say routine handling, okay, kasama yan, mixing, transport, okay, tsaka adherence to the time limits set by the laboratory, no? Okay, para ma-deliver mo yung specimen to the laboratory. Okay, so punta tayo sa mixing. Okay, so sabi natin, di ba, yung additive tubes, pag yung tube mo contains an additive, you have to invert that or mix that 3 to 10 times. And that depends, of course, on the additive present. Okay? So mamaya i-review natin ulit. Okay, ano ba? Ilang at kanina na ano na natin, 'di ba? Naaral na pala natin kanina. Okay, so gentle inversion lang. Okay, kasi sabi nga natin yung agitation pag nagalaw ng vigorously, that can of course result to hemolysis. Tama? Okay. So vigorous mixing, ayan, can cause hemolysis. Okay, not performed on a hemolyzed specimen can be your potassium, magnesium, and most enzyme tests. Okay. So Next, ayan, punta na tayo. Yan yung mixing natin. Tama, no? Okay, pag yan ay sterile, 8 to 10 times, no? Yung culture. Okay, pag yan ay citrate, 3 to 4, no? And then 5. Okay, pag yan ay glass, none. Okay, kasi, and then you have 5 to 6 times. And then, ayan na, no? Madali lang tandaan, no? 8 to 10 times na. Okay, so very important tong inversion. Huwag niyong kakalimutan, ha? Okay. Now, inadequate mixing, pag hindi mo na mix mabuti, so what do you think will happen? No? So actually, pag lack, delayed, inadequate mixing can lead to clot formation. No? Yung may micro, small clots. Okay, so hindi pwede yan sa hematology. Kasi sa hematology, you're going to count cells. Whole blood ang kailangan mo doon. Eh pag nag-clot yan, nagkumpul-kumpul yung iba, mababawasan siya. Right? No? So kaya kailangan, okay, walang clot formation. Okay, and inadequate mixing of gel separation tubes, okay, clotting may be incomplete. Okay, so pag hindi mo masyadong na-mix yung iyong tube with the gel separator. Okay, and of course, alam na natin lahat ito, non-additive tubes do not mix. Okay, yan. Okay, so proper mixing, ayan ang pag-mix, no? Okay. Inversion talaga. Okay, so 1 and then pagtaas mo, no? So saka ka pa lang magbibilang ng 1. Okay. Baba mo, pagtaas 1, baba 2, baba 3. Ganun ang pagbilang ang yan, na. Okay. So now punta na tayo sa transporting specimens. Okay. So ito, no? Sabi nga natin rough handling and agitation can hemolyze specimens. Kaya very important yung handling natin ng ating specimens, no? Okay. So aside from that, of course, pag hindi ka maingat sa pag-transport mo, okay, yan, yung rough handling na sinasabi natin, yung bara-bara ka na lang, bahala na kung ano mangyari dyan sa specimen mo, that can actually activate the platelets and affect the coagulation tests. Okay, at saka pag yan ay glass, baka mabasag. No? Okay. So, tubes should be transported stopper up, nakatayong ganyan. No? Okay. So, bakit daw ba? Of course, ayan, to prevent contact of the contents with the stopper. Ayan, kasi pag nakahiga yan, yung contents nito pupunta dito sa stopper mo. Okay, to reduce then yung agitation, no? And of course, that can aid clot formation in the serum tubes. Okay, so very important yung ating mixing, no? Okay. And transporting na pala tayo, transporting specimens. Okay? So, transporting specimens, so kailangan natin ilagay sa primary container. Ayan. So, the isang container natin, plastic. Ito yung primary, yung una. Okay? So, usually, mas maganda pag yung, halimbawa yung tube mo, i-wrap mo with absorbent package material, about tissue, gauze, ibalot mo siya. And then, lalagay mo siya dito. No? So ito yung ating transport bag, ito yung ating container, lalagay mo siya dyan. Okay, may dalawang compartments yan. Yung isa yung lagayan mo ng requisition form para hindi mahalo yung requisition form mo. No? Okay, and then saka yung lagayan mo ng sample. Kailangan may biohazard logo yan. Okay, and then of course ilalagay mo siya ngayon sa ating box. Yung, ayan yung ating secondary container. No? O kaya bag. Okay, lalagyan mo siya doon. Okay. Now, iba rin yung pag-COVID. No? So, next meeting, yun yung di-discuss natin. Paano ba yung container? Paano ba yung kapag-collect mo ang pag-COVID? No? Okay. So, yung oropharyngeal swab. Okay. So, next meeting yan. Blood lang muna tayo ngayon. No? Okay. So, transporting specimens pa rin tayo. Multiple samples from one patient. Lagay mo lang sa isang bag. Okay. So, halimbawa, may marami siyang specimen. Pwede siya sa isang bag. Okay, pagka-samples from different patients, hindi pwedeng ilagay sa isang bag. Okay, so dapat isang pasyente, isang primary container. Okay, so yan. So kung maraming samples talaga, pwedeng ilagay sa rack, no? Tapos yung rack yung ilalagay sa bag. Ayan. So another, yan yung ano, no? Okay, sabi natin pag hinawakan mo lang by hand, no? Another way naman pag transport ng specimen is the pneumatic tube system, no? Or this is also known as your pneumatic tube transport, tama? So this is a system Okay, that propels, of course, the cylindrical containers through network of tubes. Okay, by compressed air or by yan, partial vacuum. So, ano ba yan? No? Okay. So, ito yung ating pneumatic tube. Ito siya. Ayan. Nakita niyo yan. Nandito yung specimen mo. Okay. So, ano ito? This actually yung systems na to, no, or system, okay, the pneumatic tube system allows speedy, mabilis, no, and reliable, of course, automated transport of samples to the central laboratory. Okay, halimbawa, kumuha ng blood yung phlebotomy sa 10th floor. Ayan, no? So meron siyang parang station doon, no? Ilalagay niya doon yung specimen. Okay, so ibalot muna parang ganito yan eh. Padded. Nakita niyo to, meron siyang parang foam, no? Para hindi gumalaw, no? Okay, hindi maalog mabuti, no? So meron siyang pad na ganyan. Okay? So, pero it's still, this is more traumatic, no? Pwedeng ma-agitate, no? Kaysa doon sa by hand. Okay? Kaya lang ito, faster ang delivery. Talagang mabilis. Lagay niya lang dito, tapos lagay niya doon, and then pupunta na yan doon sa central lab. Yan. Yan ang pneumatic tube system. So sa laboratory natin, okay, meron tayong video dito. Ito yung ating video presentation. No? So tawag natin dyan pneumatic tube system. Okay? So yung ano daw, number of studies, meron mga number of studies, sabi doon. So ito daw talagang pwedeng mag-replace ng human courier transport, yung by hand na. Okay. So kasi this significantly reduces the turnaround time. Okay, kasi mabilis eh. Pagka-extract, okay, lagay lang doon. Sa laboratory na kagad. So unlike pag yan ay yung human courier transport, hahawakan niya yan, then bababa na naman siya doon sa lab, tapos ipupunta na naman siya sa ibang ano, tapos bababa na naman siya sa lab. Tama? Na? So ito, lagay mo lang dito, punta na siya sa laboratory. Right? Lalagay mo lang siya dyan. Para may mga station sila. And then, punta na yan. Okay, sa lab. Kukuhanin na lang yan doon sa laboratory. Okay? So, in transporting specimen, you have to avoid extreme temperatures. Commonly, yung mga specimens natin ay transported at room temperature lang. Now, except of course, meron tayong mamaya yung special handling. No, merong talagang temperature required. Okay. So pag masyado daw mainit, no, o kaya freezing temperature, pwedeng mag-rupture yung RBCs mo. No, kaya yung CBC. Kaya pag CBC yan, talagang room temp lang yan siya. Na? Okay, so preferably mas maganda kung is-separate mo na yung serum, okay, and the plasma from cells before transport. Okay, kung wala ka namang centrifuge doon, okay, sa lugar mo kung saan ka nag-collect, it's okay. No? Basta ma-submit siya doon sa laboratory immediately. So samples in the car should be placed in a cooler kasi mainit yung kotse, right? Na baka masira yung mga red blood cells natin. Okay, now, paano naman mag-transport ng mga, ayan, no, yung pang blood alcohol testing, pang paternity testing. Okay, very important dyan yung chain of custody, no, yung may form yan. Okay, so ito yung i-discuss natin in the laboratory. Okay, so yung how to fill out the, yung custody and consent form. Okay, so pag sinabi mong chain of custody, yan ay documentation, no, of proper sample identification from the time of collection to the receipt of laboratory results. So ang ano niyan, this requires actually detailed tracking of specimen from collection, no? Ayan, no? Sabi dito chronological documentation or paper trail. Merong form, no? So pag-collect, may pumipirma, may signature. Okay, so yan i-discuss natin sa lab, no? Pag-transfer, pag-receipt, no? Pag-analyze, storage, hanggang sa disposal. Okay, merong paper trail yan. Na, okay, monitoring process to prevent, of course, tampering. Na, ayun, yung mga, di ba? O kaya switching, yung mga ganyan. Okay, so kasi medical legal eh. No? So this ensures that any results reported, okay, relate, of course, beyond reasonable doubt to a particular individual. Kanya talaga yung specimen na yan. Okay. So kanya talaga yung specimen na yan. Now, so for blood alcohol testing, okay, so merong special draw kit, okay, and then syempre hindi, sabi ko nga, hindi pwede alcohol as the antiseptic, na, at kailangan talaga may chain of custody form. And then sa paternity testing, siya ba yung tatay o hindi, right? Na, okay, so kailangan ma-establish, no, yung specimen na talagang sa kanya galing. No? So may, again, may custody form, no? Pwedeng may documentation that samples were collected from the correct individuals. So itong sample na to, sa kanya talaga kinuha. Itong sample na to, dito talaga sa yan kinuha, sa nanay, alleged mother or father. Okay? Now, so punta na tayo sa special handling. No? So special care, pag sinabi mong special handling, special care is needed now when handling blood specimens to protect its condition and quality. Okay, so merong special okay, care. Okay, so sabi ko nga kanina, kadalasan ng specimen transported lang yan at room temperature. Okay, so merong mga specimens na okay, requires of course, ayan, special handling. So first nating aaralin yung mga specimens that should be transported and stored at body temperature. Okay, so pag sinabing body temperature, that's around 37 degrees Celsius. So kailangan i-warm mo yung samples. So, yeah, no? So specimens, okay, usually ito yung mga nagpe-precipitate at cold temperature because of these analytes, itong mga to. May cold agglutinins yan, no? Merong cryo. Cryo means, cryo pala ito, ha? Malagyan nyo ng O yan, cryofibrinogen. Okay, so cryo means cold. No? So, yung specimen nagpe-precipitate pag cold temperature. Kaya kailangan naka 37 degrees Celsius when you transport, okay, and store the specimen. Okay? So, kailangan yung tube mo pre-warm 37, tapos i-transport mo siya 37 degrees din. No? So yung mga malalamig na mga dito sa Pilipinas, wala tayong problema dito sa 37, no? Kasi sometimes yung room temp natin nasa 37. Yung malalamig na mga countries, no? So kailangan nila ng mga heat blocks. Yan, yung mga ganito, no? Heat blocks para i-transport yung specimen. No? Now, kung walang ganito, okay, pwede siyang i-wrap doon sa heel warmer. No, pag okay lang naman na if the specimen can withstand higher than 37 degrees, pwede. No, pero mas maganda siguro yung mga heat blocks na talagang 37 degrees Celsius. No? Okay. Now, kung ito warming, ito naman chilling. No? So chilling usually nasa 4 degrees Celsius. So can be, ito yung range 2 to 8. Okay, but preferably 4 degrees Celsius. Okay, so yung chilling daw slows the metabolic process. So hindi nasisira yung analyte, yung specimen. Okay, so mahaba pa ito, no? Ito lang yung common. Okay, so paano mo siya i-chill? No? Pwede mo siyang i-submerge, no, sa crushed ice. Okay, mas maganda pag yan yung slurry, no, water slurry, tama? No, so hindi pwede yung mga big cubes, no? Kailangan meron siyang tubig na kasama. Kasi baka mamaya na ma-hemolyze yung specimen mo. So pag sinabi mong slurry, that's actually watery mixture, no? Parang mixture of ice and water. Parang semi-liquid, parang ganito. Now this is a slurry. Okay? So pag ganito naman, lagyan mo siya ng tubig. Lagyan mo siya ng tubig. Now, of course, yung mga ibang laboratories, merong blood specimen transporter talaga. Okay, yung temperature niyan ay malamig. Para siyang naka-cooler. Okay, so ganyan. So, what are the tests that require chilling of specimen? Ayan, yung ACTH natin, yung acetone, tama, no? Okay, ammonia, acid phosphatase, catecholamines, lactic acid, no, parathyroid hormone, and the blood gas analysis. Okay? Ayan. So, yung light sensitive naman, ito naman yung mga ipoprotect natin from light, na direct light, na kasi nagdi-decrease, okay, upon exposure to direct light. So yung bilirubin nga daw, decreases, no, up to 50%. Okay, after 1 hour of light exposure. Imagine mo yan, no, nangalahati, no, 1 hour of light exposure lang. So anong gagawin mo? Pwede mong i-wrap, no, sa aluminum foil, okay, o kaya yan, light blocking amber tubes, ito yung mga ganyan. Yan. Okay? So, pwede mo siyang i-wrap. Ayan. Pwede kang gamit ng amber or dark colored. Okay. Pag urine, ano naman pala tayo ngayon, blood lang. But anyway, ano na natin, ganun din, amber container. So, what are the other light-sensitive analytes? You have the folic acid, yung carotene, no, vitamins B2, okay, B6, B12, and vitamin C. No, urine porphyrins, no, urine porphobidinogen. These are light sensitive. Okay? Ayan. So ito, very important. So in fact, kinuha ko to sa clinical chem book. Right? Okay. So, ayan. So, examples of specimens that require special handling. Yan. Ito, no, kailangan you have to keep at the 37 degrees Celsius. No? Ito, kailangan naka-chill, no, in crushed ice slurry. So, yan yung parang crushed ice with water. Okay. And then protect from light because these are light sensitive. No? Okay, photosensitive. Okay, analytes. Yan, very important tong slide na to. Okay, now, punta na tayo sa blood specimen processing. Okay, so pag sinabi mong processing, nandun na sa laboratory. No, na okay, nadala na transport na. Okay, nandun na sa laboratory. Okay, anong gagawin doon sa lab? No? So, yung mga specimens, pagdating doon sa laboratory, okay, dinadala mo na yan sa triage. No? Nandun siya sa sample reception area. Okay. So meron din tayong topic na gano'n, na sample reception area. So yan, collected specimens are transported to the central processing triage for screening and prioritizing. So ano ba pag stat? Una mo nang gagawin yan. Okay, screening, titingnan, specimen suitability. Okay, pwede ba to or i-reject? Ganun yan. So, doon sa triage, para bang ano yan eh. Di ba? Naririnig niyo yung triage dyan sa mga hospitals because of COVID, di ba? Okay, pagpunta ng patient dun sa hospital, may triage sila. Yun yung taga-screen. Ano ba to? COVID ba to? Hindi. Ganun. Okay, parang ganito din. Yung specimens. Dito in-identify, no, yung specimen, ina-accession, no, nilalagyan ng number. Okay, may number na siya, ito yung number niya, ganun yan. No? And then sinusort, okay, by department. Saan yan dadaling department? Okay, hematology ba? Okay, clinical chemistry ba? No? Okay, and the type of processing, anong gagawin doon. No? And then that will be evaluated for specimen suitability. Okay, i-reject ba natin to o hindi? Ganun, na? Okay. So, of course, okay, doon sa sample reception area, okay, i-reject dapat yung mga unsuitable specimens and then obtain new specimens para accurate yung results mo. No? So, most frequent reason for rejection sa chemistry ay hemolysis. So, pag hemolyzed yung specimen, nagpapa-collect sila ng another specimen. Okay, o kaya naman insufficient amount kasi kailangan mo ng serum eh. So pag kailangan mo ng serum, tama, no? So kailangan mo ng mas maraming specimen blood. Kasi isi-centrifuge yan. Kukunin mo lang will be the liquid portion. Okay? So sa hematology naman, ang most frequent reason for rejection ay clotting. Yan. Kahit sa coagulation studies, yan din. Clotting at saka yung underfilled. Pag yan ay coagulation studies. Okay? Ayan. So, naaral na natin to. Ulitin na naman natin ulit. No? Specimen rejection criteria. So, hindi na-identify properly, no? Inadequate volume, okay, hemolysis, nasabi na natin, wrong tube. Tama na? Okay. So, dapat coagulation studies pero nilagay sa ano? EDTA, mga ganun. Na? So, tube use is outdated, expired na. No? So, clots, may clots. Okay, so contaminated specimen, insufficient, kulang, no? Quantity not sufficient. Okay, incorrect collection time. Okay, and then exposure to light, pag yan ay bilirubin kasi hindi naka-wrap. No? Okay, so testing time limits not followed. Okay, and then of course delay, okay, or error in processing. Okay, tagal, no, bago nadala sa laboratory. Okay. So, gaano ba dapat, no? Ano ba yung delivery time limits natin? Okay. So, blood should be transported to the laboratory without delay. Okay. So, routine blood specimen should arrive at the laboratory within 45 minutes of collection. Okay. So, 45 minutes, kailangan nandoon na siya. Okay, and then of course, specimens that require separation of the serum or plasma from the cell should be centrifuged within 1 hour. So, dapat madala siya sa laboratory within 45 minutes. Okay, then pagdating sa laboratory, kailangan ma-centrifuge na siya, ma-separate na yung serum. Okay, kung yan ay pag yan ay chemistry, no? Okay, ma-separate na yung serum within 1 hour pagdating niya doon sa laboratory. Okay? So remember, of course, yung hematology test specimens natin na nasa EDTA ay hindi yan sinacentrifuge kasi whole blood ang kailangan natin dyan. Okay, so pang processing dyan will be mix mo before analysis. Okay, now, bakit may minutes at baka naka-underline yan? Because that's very important. No? Okay, so maximum time limit, no, for separating serum and plasma from the cells, 2 hours from the time of collection. Okay, so 45 minutes dapat nadala mo na. Tapos within 1 hour, kailangan ma-separate mo na. No? O kaya may allowance ka pang 15 minutes. No? Kaya kailangan 2 hours from the time of collection. Okay, kailangan ma-separate mo na siya. Okay, that's very important. Bakit? No? Okay. So, yan, no? So, yung serum tubes daw that had not been spun within 2 hours, okay, or hindi mo ma-refrigerate yung iyong serum, no, before, yan, okay, centrifugation will, okay, increase the potassium. Okay, creatinine, phosphorus, okay, LDH, the lactic acid, the lipids, and the total protein. Okay, so, and then of course, yung glucose po magdi-decrease at saka ito. Okay, so remember, it's important for us to separate yung cellular, no, and the liquid portions of blood as soon as possible. Okay, 2 hours, ha? Kasi, bakit po yan, ma'am? Okay, this is because the cells interact with the serum and the plasma. So, yung cells mo, mga red blood cells, no, you have the leukocytes, nag-i-interact yan, no, with the serum and plasma, altering its chemical composition and affecting the test results. Ito na nga yung test results mo. No? Okay, so the longer a specimen remains in contact with the cellular elements, the greater the effect on the test results. So in general, ilang hours, processing should occur within 2 hours of collection. So kailangan ma-separate mo na siya, ma-centrifuge mo na siya. Tama, no? Okay, ma-separate mo na yung serum mo. Okay, 2 hours. Okay, so ganun yun, ha? Okay, very important yan. Now, very important yung glucose. Ito, no? So kasi yung glucose is used by cells. Okay, ginagamit ng cells, di ba? Hindi siya nakaseparate, kasama pa sila doon. No? So, nagagamit siya ng cells. Okay, kaya nababawasan siya. Ang tawag natin dyan, glycolysis. So glycolysis. So glycolysis continues in the blood specimen, lowering your glucose levels until the serum or plasma is physically separated from the cells. So very important that you're going to separate immediately. Okay, mas maganda, agad-agad mas maganda. Okay. Now, potassium, sabi nga natin, and also yung coagulation studies natin are also affected. Okay, kaya kailangan mas maganda, madala agad sa lab, tama, at ma-process ka agad. Okay, so prompt delivery and separation minimize glycolysis. So kung hindi mo madala agad, within 2 hours, you use sodium fluoride because sodium fluoride prevents glycolysis. Okay, so ayan. So yung non-additive and gel barrier, yung mga yan, okay, kailangan, of course, okay, completely clotted before centrifugation. Ay, may mga gel barrier, serum tubes, yung separator. Mas maganda yung may separator na yan para barrier yan may barrier, tama? Okay, doon sa ating what you call this, serum, right? And tsaka doon sa ating cells. May harang. Okay. So, para hindi mag-react yung cells doon sa ating serum. Okay? So, pag yan naman ay heparin, yung mga plasma separator tubes, mix mo lang yan, pwede mo na siyang i-centrifuge agad-agad. Okay? Pag yan ay serum, separate, kailangan hintayin mo muna siyang mag-clot. Anyway, if you're using the thrombin, 5 minutes lang, clotted na yan. Okay? Yan. So remember sa chemistry, mas gusto nila yung serum kasi clear siya, right? Okay. So specimens in gel separation tubes usually do not require manual separation. Okay. So pwede ka nang kumuha doon ng specimen. Right? Okay. Unless of course kung kailangan mo siyang i-alicot preparation. Mamaya aaralin natin 'yan, no? Okay. So kung gusto mo lang konti lang yung specimen na kailangan mo, okay, pwede ka nang diretso kumuha doon sa iyong specimen, na? Okay, doon sa na-separate mo. Okay, now, let's move on. Punta na tayo sa time limit exceptions. Okay, so pag yan ay stat or medical emergency, ay agad-agad yan. Now, priority yan. Okay, so hindi ka na kailangan ng 2 hours. So, kailangan agad-agad analyze yan. Okay, now, that's for blood chemistry determination, serum separation, right? Now, how about yung CBC? Okay. So pag yan ay blood smears from EDTA, di ba? Pwede tayong gumawa ng blood smears from EDTA. Tama na? Okay. Pag galing yan dun sa EDTA tube, okay, kailangan, that should be prepared within 1 hour. Kasi pwedeng ma-deform yung mga cells natin. Tama, no? Okay. Pag blood smear, kailangan, di ba? Buo yung red cell mo, no? Okay, yung mga WBCs mo. Kaya this should be prepared within 1 hour. Okay? And then yung CBC natin analyzed within 6 hours. This is recommended. Okay, so although pwede pa rin naman siyang gamitin within 24 hours, but what is recommended is 6 hours. Okay, so pag yan naman nasa microcontainers, that should be analyzed within 4 hours. Yan, yung mga hours yan, very important. Okay, so ito naman yun yung time limit niya. But if you can examine that immediately, ay mas maganda. No? Okay. So yung ESR naman, 4 hours din. Okay, pag refrigerated, 12 hours. Okay. Pag reticulocyte count, okay, so 6 hours din. Okay? So up to 72 hours if refrigerated. Okay. Now, pag glucose, ayan, sa fluoride, gaano katagal yan, ma'am? Okay, pwede siya hanggang 24 hours room temperature. Pag ni-refrigerate mo yan, 48 hours. Okay. Pag prothrombin naman, okay, pwede siya hanggang 24 hours after collection. Okay? So, yan. And then pag partial thromboplastin time, okay, within 4 hours of collection. Okay, so ito medyo 4 hours. Okay? So, yan yung time limit. Okay. So, now, punta na tayo sa centrifugation. Okay. So, sa centrifuge na natin. So, pag sinabi mong centrifugation, this is a process in which centrifugal force is used to separate, okay, the solid matter, yung ating cells, from a liquid suspension, as from our serum or plasma. So ang ginagamit natin dito is a centrifuge, tama? Okay, machine that spins, of course, the blood and other specimens at high number of revolutions per minute. Tawag natin dyan RPM. O kaya centrifugal force. Okay. So of course, this is used to prepare yung samples natin, yung blood, body fluids, sa chemistry analysis, and then of course, urine, pag urine, centrifuge din yan. Tapos ginagamit lang doon sa analysis is the sediment. Okay, so yan. Now, ano ba yung mga iba-ibang klaseng centrifuge? Meron tayong refrigerated centrifuge. Ayan, meron tayong ganito sa school. And then merong ding floor top. Ibig sabihin ng floor top, nandun siya sa floor. Ayan, nakapatong doon sa floor. Meron din kasing tabletop, yung mga maliliit na kapatong sa table. Tawag natin dyan bench top model. Okay, so yung relative centrifugal force depends on the speed of the rotation. So mas gusto nila ngayon yung RCF than the RPM. Kasi yung RPM, rotation per minute, or revolution per minute. That depends now on the size of the rotor of the centrifuge. Kung malaki yan, pag 1 minute, ilang ikot lang yan. Pag maliit yan, pag 1 minute, ilang ikot yan. Okay. Kaya mas gusto nila yung relative centrifugal force. So may formula yan yung conversion. Okay. So sa CC nyo na lang yan aaralin or in your chemistry. Okay. So depends on the speed of the rotation and the radius of the yan nga, rotor head. So there's a formula to convert no, yung RPM into relative centrifugal force. So expressed in as gravity or G na or RCF, relative centrifugal force. So mas kadalasan ginagamit yung G na. Okay. So most specimens are centrifuged for 15 minutes at 750 G to 1000 G. So sa Bishop naman, sa chemistry, ang sabi niya doon, pag blood, pwedeng 10 minutes. Pero ang gravitational force niya is increased na sa 1,000 to 2,000 G. Okay, so ito yung kinuha ko kasi ito yung nasa libro niya, nasa book niya. Okay. Para di kayo malito. Okay, sa Bishop kasi yan. Pwede mong i-increase ito, itong G mo, 1,000 to 2,000, less yung number of minutes. Okay, 10 minutes lang. So, yan, yung pag nag-centrifuge tayo, very important yung stopper, yung cover should remain on the tubes. No? Kasi pag tinanggal mo yung stopper mo, okay, removing the stopper will result to yan, aerosol formation, pwedeng mag-change yung pH niya, no? Okay, mag-evaporate. Okay, so pag nag-evaporate yan, nabawasan ng tubig, no? That can lead to concentration of analytes. And then pwedeng contamination, no? Baka pag walang cover, mapatakan ng sweat, no? Okay. And remember that your sweat contains increased amount of sodium and chloride, so that will interfere with the electrolyte analysis. Okay. Kasi pag electrolyte analysis, di ba, nandiyan yung sodium, potassium, chloride, yan. And then pag yung gloves, no, pag hindi mo natakpan yan, baka yung powder dyan sa gloves mo will interfere. Okay, kasi yung gloves natin merong calcium metabolite or okay, that will interfere with your calcium determination. Okay. So, pag nag-operate tayo ng centrifuge, kailangan balance. Okay, so balance. Okay, kailangan yung tubes natin equal yung size. Okay, tapos magkatapat silang ganun. Okay, so sabihin mo, ma'am, paano? Isa lang yung tube ko. Anong gagawin ko? So, kailangan mo ng balancer. Same tube size, okay, same amount, lagyan mo na lang ng water yung isa. Tawag natin dyan balancer. Okay, so pag unbalanced daw kasi yung centrifuge mo, pwedeng mabasag yung specimen mo. No? Kaya mabasag yung specimen, mabasag yung tube mo. Okay, that can ruin their specimen and cause, of course, the content to form aerosols. No? Okay. So, and of course, kailangan naka-cover siya, nakatakip. No? Okay. At saka, wag mo siyang bubuksan hanggat hindi pa siya nag-completely stop. Okay? So, yung iba kasi, no, nagmamadali, no? Hindi pa nagka-stop, binuksan na kaagad. Right? Okay. So, yan. Okay? And of course, ito yung mga parts ng ating, yung importante lang, ito yung rotor niya. Ito yung, yan, yung umiikot. So, tinitingnan dyan yung diameter nito. Yan yung kinocompute for the relative centrifugal force. And then, meron siyang lead. So, itong parts na to, depende sa centrifuge. Okay. So, yung iba, wala naman silang LCD display. Dipihit. Parang, diba, parang halimbawa, yung mga microwave natin, di ba, merong iniikot, merong pinipindot lang. Okay. So, ito, mas maganda kasi may buttons lang siya. So ito, kahit hindi ninyo na anuhin yan, kasi depende naman yan sa centrifuge. Yung iba walang ganito. Okay? So ito lang, you see, meron siyang rotor, siyang lead. Okay. Now, specimen should never be centrifuged more than once. Yung tawag natin dyan, yung repeat centrifugation. Yung centrifuge mo na, tapos centrifuge na-disturb, lalo na pag wala kang gel separator, tapos kinuha mo, nagkumuha ka ng separate mo. Kasi when you separate, you're going to use tawag dito mamaya. You're going to use tawag dito transfer pipette. Okay, so yung transfer pipette, papipette mo siya, tapos lalagay mo siya sa another tube. Okay, so ang nangyayari doon, pag wala kang gel separator, pwede mo siyang ma-disturb. Tapos pag na-disturb mo, recentrifuge ka na naman. So repeat centrifugation can cause hemolysis and analyte deterioration and alter the test results. So kaya mas maganda pag you have the gel separator. Para pa hindi siya madi-disturb, talagang hindi ka magre-repeat centrifugation. Okay? So yung mga specimens that require chilling, okay, kailangan i-centrifuge mo siya sa yan, no, refrigerated centrifuge na sinasabi. No? So temperature controlled, no, refrigerated centrifuge. Malamig doon sa loob ng centrifuge. Na? Okay. So, pag plasma naman ang kailangan mong specimen, syempre pag sinabi mong plasma, o hanggang ngayon dapat hindi na kayo nalilito sa plasma at saka sa serum, ha? Okay. So, of course, yun yung may tubes na merong anticoagulant. Okay. So, centrifuge without delay. Halimbawa, yung green top heparin, tama, no? Okay. So that can save time kasi hindi ka na we-wait, no? Mag-clot. Tama, no? That can reduce the turnaround time. Okay? So, yung mga yan, plasma separator tubes. Okay. Kaya lang, ang ano naman dyan, ang problem lang, di ba, pag yan ay may anticoagulant, pag plasma, di ba, mas gusto nila yung serum kasi that's clear. So, mas clear yan. Okay, at walang fibrinogen. Right? Okay. So, blood completely clotted, okay, before centrifugation. Tama? Kailangan you wait for the specimen to clot before you centrifuge. Complete clotting actually occurs 30 to 60 minutes at room temperature pag walang clot activator. No? So, tagal. No? Okay. So, longer to clot yung mga patients on anticoagulant medication, no? Yung mga specimens from patients with high WBC counts, at saka yung chilled specimen, yung mga malalamig, matagal mag-clot yan. Okay? So kaya yung iba nilalagay nila sa yan, yung room temperature, medyo mainit ng konti, tama na. Okay, para mas mabilis siyang mag-clot. But again, no, gamit na lang ng clot activator. Yan. So, yung clot activator, nagka-clot, okay, ang pinakamatagal na is 30 minutes. Commonly, mga 20 minutes, clotted na. Ganun, no? Okay. Pag thrombin ang ginamit mo, usually in 5 minutes, nagka-clot na siya. Okay? Yan. Now, pagtanggal mo ng stopper, yung takip, no? Okay, make sure that you're going to remove it this way. Okay, nandito yung thumb mo, nandito yung index finger mo, pataas. Yan, pull straight up. Yan, pataas ang yan. So, you have your vacutainer tubes there, no? Pwede niyang i-practice. Pataas. Okay. So, pwedeng yan yung manual kasi may mga laboratories meron silang machine na pagtanggal ng ng cap. Okay. So mas maganda, sabi dito, you're going to cover this first with gauze or tissue, no, para hindi mo siya kung may mag-drop man diyan, hindi magpunta diyan sa kamay mo. Okay. And to prevent, of course, the release of the aerosol. Ito. So pull straight up, no? Okay, hindi yung thumb lang ang ginagamit mo. Tapos niro-roll mo siyang gano'n. So kailangan dalawa hawak mo and then pataas. And then mas maganda daw if you're going to wear face shield pagka nito, o kaya goggles. Kasi baka mag-splash. Okay, yan. Recommended lang yan. Okay. Now, after centrifugation, okay, you now have your serum. No? So, normal yan is pale yellow. Ganyan siya. Pag icterus yan, okay, dark yellow. Ito siya. Icteric. Okay. So, icteric serum. Okay. And usually this contains increased bilirubin. Okay. So, pag icteric yan, okay, at galing yan sa patient na may jaundice, hindi mo yan siya i-reject. No? Paano i-reject yan? Yung tinitingnan mo doon kung mataas yung bilirubin or not. Right? No? Okay. So, ano na yan eh. Although that, okay, that of course, okay, affect also the results, the other results. No? But of course, wala ka na. Kahit naman i-reject mo yan, sabihin mo, repeat another specimen, bukas kukuha ka, ecteric pa rin. Right? Okay. So, pag ecteric yan, yung report, no? You're going to include in the report that the specimen was ecteric. Para kung tumaas man yung other results, so alam nila that's because of the color of the specimen. Okay. So, lipemic naman, okay, yung lipemic, okay, ito, ganito. Okay, yan. Parang turbid. Tapos puti. No? So usually fats. So kadalasan pag hindi nag-fasting yung pasyente, Tapos yan, taas yung lipids, triglycerides and cholesterol. Okay? Kasi dapat ganito yung normal after centrifugation, before centrifugation. So you have here the clot activator, you have here the separator, the gel separator. Okay? So pag ginalagay mo dyan, ayan, nandiyan siya. No? Okay. So kaya pag nag-separate ka dito, hindi na di-disturb ito. No? So ito lang yung serum na kailangan mo. Okay? And then of course, okay, mataas yung lipids nun. Okay, yung iba, now there are laboratories na pagka ganito yung specimen nila, lipemic, they ask for another specimen kasi turbid, no? Okay. Tapos tatanungin muna nila, nag-fasting po ba? No? Kasi baka hindi nag-fast yung patient. Okay? Tapos kung halimbawa sabihin nag-fast yung patient, so you accept, no? Okay. Kasi wala ka namang magagawa, nag-fast naman yung pasyente. Okay? So pero pag hindi nag-fast yung pasyente, you ask for another specimen. Okay? So yan. Okay, kung madali naman, that depends on the protocol of the laboratory again, because others pag lipemic, humihingi agad ng another specimen. Okay, and hemolyzed usually. Okay, this is a ground for rejection. Okay, kasi baka sa technique lang ng tawag dito ng phlebotomist. Okay, so but of course meron din mga conditions na talagang laging hemolyzed yung specimen. So i-reject lang muna, then repeat. Tama, no? Tapos pag nag-repeat, ganun pa rin. No? So pwede mo nang i-analyze. Baka that's because of talagang yung condition ng patient. No? Okay. So there's the destruction of red blood cells. Okay, so of course, this increases the potassium, yung ammonia, the phosphates, and the enzymes. And then magnesium din. No? Okay. So again, you have the normal, you have the icteric, you have the hemolyzed, you have the lipemic, no, specimen. And bagyan ay hemolysis, pwedeng slightly hemolyzed, moderate, and then, okay, severely, no, okay. So hemolyzed. Now, let's move on to the last, okay, topic. This is the aliquot preparation. Aliquot daw yan, pronunciation, okay. Pero tayo, di ba, okay, usually aliquot lang yan, no? Okay. But anyway, so aliquot preparation, ano ba yun? No? So this is a portion of the specimen used for testing. So yun yung pag-separate natin. Ayan. We're going to separate and then we are going to use this specimen for testing. Okay. Yan yung aliquot niya. So pag sinabi mong aliquoting, no? Okay. Aliquoting. Okay. So method of dividing or separating specimens into separate containers. Okay. So meron kang one or more tubes, no? So ilalagay mo yung specimen mo doon. Okay. So bakit ba ganon, no? So bakit ba tayo naghihiwalay ng ganyan, no? So this is created when multiple tests are ordered on a single specimen. Halimbawa, isang specimen lang yan, tapos maraming tests. Tapos iba-iba yung machines, tama, na mag-a-analyze noon. So kailangan mo siyang i-aliquot. Ilagay mo siya sa iba-ibang tubes. Tama, no? So yun yung aliquoting. So kung tayo sana ay nag-face to face, yan yung gagawin nyo. No? So isa-separate nyo yung, okay. So here now, of course, ayan, separate mo lang siya using the transfer pipette, disposable transfer pipette. But make sure, ito ang gusto kong emphasize dyan, kailangan may label yung inyong tubes, yung transfer tubes or yung aliquot tubes nyo. So kailangan merong label yan. Now, very important yan. Okay, kasi common yan error. Yung walang label yung kanyang aliquot tubes. Okay, so ayan, aliquot tube should be covered or capped as soon as it is filled. So pag nalagyan mo na, okay, kailangan takpan mo siya. Okay, so yan yung ginagamit for analysis. Okay, so transfer a portion of the specimen into one or more tubes using a disposable transfer pipette. Properly label the transfer tubes. Okay, so yan. Okay, now, ano daw ba yung mga kailangan nating PE? Pagka yan ikaw ay nagpa-process ng specimen. Okay. So, according to OSHA, no? Okay. So, sa books nyo, ito lang tatlo, no? Okay. Gloves, laboratory gowns or coats, at saka yung masks, no? But, of course, there are laboratories na kailangan yung goggles and the face shield, lalo na when you, okay, yung processing, during the processing. Kasi pag tanggal mo, no, ng cup, no, baka mag-splash dyan sa eyes mo. Mas magandang meron ka. No? But of course, okay, that depends on the laboratory. Okay, so that depends also on the risk assessment. No? Ano bang meron doon sa specimen? Ano bang possibly sakit ng pasyente? Tama? Okay, but OSHA said na itong tatlo lang yung kailangan. No? Okay. So, okay, so that ends the lecture. So thank you very much for listening.